Hi, I'm Dr. John McMenamin. I'm a GP from Wanganui, and with me today I've got Kiri Milne, who's working with the Health Promotion Agency on early pregnancy and looking at how to help women avoid using alcohol during pregnancy. So Kiri, do you want to just tell us a little bit about some of the work the Health Promotion Agency is doing?
Yeah, sure. The Health Promotion Agency has just recently launched a campaign, in fact, that targets young women who are drinking. The idea of this campaign is really to get the message out there to all young women, not just pregnant women, but all young women, that there is a risk to a potential pregnancy if they're drinking early on in pregnancy when they don't actually realise that they're pregnant. So what we've done is we've developed an ad, developed some other material that's largely online. Young women, 18 to 30-year-olds are seeing online. And as I say, it's really just trying to raise awareness amongst young women that actually if there's a time when they find themselves wondering whether they might be pregnant, then they need to stop, pause and think about whether or not they're going to drink at that time.
So this might represent a bit of a difference in focus from just concerned about pregnancy to concerned about also somebody who might become pregnant.
Absolutely.
So for a woman who is pregnant, what's the message that we want to get across?
The message for women who are pregnant is don't drink at any time during pregnancy, including in that early time when you're still confirming whether or not you're pregnant.
Okay.
And in fact, I'll just add to that, and in fact, if you've already drunk, it's still a good time to stop, then that's still going to increase the chance of you having a healthy baby. So. Okay.
So the message that we want GPs to support you with is there's no safe evidence for drinking during pregnancy. If you are currently drinking in a pregnancy, stop now. If you are thinking you might be pregnant or you are thinking about becoming pregnant, avoid alcohol.
Absolutely.
That's great.
And as you mentioned, John, health professionals, GPs, practice nurses, midwives have an absolutely critical role in this space, and one of the things we're interested in doing is working with health professionals to support them to have these conversations, and that's something that I know you're involved in.
Yes, yeah, that's great. I'll talk about that in a minute. I just want to mention, I know you've got an advertisement out there, but I haven't seen it myself in the sense of on television. Can you explain why that is?
Yeah, it's not on television actually, and that's because we've chosen a really niche market, 18 to 30-year-old women who drink. They don't hang out on mainstream television, on free TV. They're online. They're across multiple platforms. They're on their phones. They're on their PCs, on their iPads. So we've really gone with finding them where they are in the online environment. So they'll see it on their Facebook feeds. They'll see it on YouTube, on TV on demand programs that they're watching.
Okay.
If you're old, if you're not female, and if you're outside of that age bracket, you're much less likely to see this ad because it is quite highly targeting those women.
But as GPs, we could perhaps ask our younger female patients, have you seen that advertisement?
Absolutely.
That's encouraging you to think about whether you could be pregnant and to avoid alcohol, and we might bring that into relevant consultations.
Yeah, really good opportunity to start a conversation.
That's great.
Absolutely.
So that kind of feeds into the whole alcohol screening that we're generally encouraging for the population, the ABC alcohol program, but particularly the ABC alcohol for younger women. We know that we have dashboard reminders that advise us if this person's had alcohol use assessed. And I guess what we want to say to support this process is if a younger woman is coming in or a woman who potentially could become pregnant, we want to make sure that alcohol flag has been addressed and that the woman has had the questions asked about what her current use is and had a discussion around what might potentially happen if she did become pregnant.
Absolutely, yeah.
So that would be great. And also I guess it reminds me just to mention that we have a new tool as well for early pregnancy, the early pregnancy assessment tool, which is going to allow GPs to use a clinical form to do a complete assessment in early pregnancy that will include alcohol as well as other pregnancy risks, clinical risks, smoking, domestic violence. We'll put reminders on about vaccinations and so forth, and which will identify women who might be at increased risk and look at women who might need to be referred. As far as alcohol is concerned, then those that are identified as drinking during pregnancy, some of these may have difficulty stopping, and we might need to think about what our management of that would be.
Yep.
So perhaps we might be encouraging GPs to think, if I identify somebody who's drinking in pregnancy and I have a concern that they might not be stopping, what pathway can I follow to ensure that they will have the right support to be able to actually quit alcohol altogether?
Yes.
Yeah.
And look, we've actually put a few tools on our website, alcoholpregnancy.org.nz, which gives some information to health professionals about what they can do in terms of referring women, and also some advice around or help around how they can have these conversations.
Yes.
So that's something that health professionals might want to have a look at, see what they can find.
So they can easily access that through the Health Promotion Agency website.
Yep.
And if practices are interested in resources, interested perhaps in looking at that early pregnancy assessment tool, there's an inquiry section there?
That's correct, yes. So
Great.
follow the inquiries.
Follow the inquiries.
info at,
Okay.
And someone will respond. As I say, we've got posters, we've got resources, messages that you can promote to women, but also resources for health professionals. And if you're interested in the early pregnancy assessment tool, we can also put you in contact with the right people to follow that up.
Okay, so I guess we could wrap this up by saying that no alcohol is known to be safe in pregnancy, so we've got a very clear message. Avoid alcohol if you are pregnant, or you could be pregnant, or you are planning to become pregnant. And as GPs, use the tools we've got to make it all work.
Absolutely.
Great. Thanks very much,
Thank
Kiri.
you.
Great.